Hello, everyone. My name is Madiba Chaudhry, and I am the Health Equity Coordinator at CASA. I want to welcome you and thank you for joining us today for CASA's 11th Annual Health Equity Summit. Also, if you're comfortable, I will like to ask the attendees to put their pronouns and organization name. And now I would like to begin today's summit with a land acknowledgement. So we are grateful for the opportunity to gather virtually on this land and thank the generations of Indigenous people who have taken care of this land long before other nations groups came. We acknowledge that the work of CASA takes place on traditional Indigenous territories of the Huron-Wendat, Haudenosaunee, and the territories of the Mississaugas of the Credit. This territory is part of the Dish with One Spoon Treaty, an agreement between the Anishinaabe, Haudenosaunee, and the Allied Nations to share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, it's Toronto, the traditional Mohawk name of this area called Toronto, meaning trees in the water. And its surrounding areas are still home to Indigenous people, and we are grateful to have the opportunity to meet, work, and play on this territory as settlers. We wish to express gratitude to Mother Earth for the resources we are using and honor all the First Nations, Métis, and Inuit people who have been living on the land since time immemorial. The recognition of the contributions and historic importance of Indigenous people must also be clearly and overtly connected to our collective commitment to make the promise and the challenge of truth and reconciliation real in our communities. As today's session focuses on health equity, it is particularly important for us to recognize the severity of health inequities in Indigenous communities. We stand in solidarity with Indigenous communities in calls to all levels of the government to develop Indigenous-led health policies and practices that are informed by Indigenous healing practices. We must hold our governments and health institutions accountable and advocate for increasing equitable access to healthcare for Indigenous people. We also need to continuously educate ourselves about the colonial history of this country and understand how the wrongdoing of the past still impacts the health and well-being of Indigenous communities. And as I've mentioned today, I encourage everyone at this session to actively seek information and take action, especially as we recognize the National Day for Truth and Reconciliation on September 30th. At this time, I would like to invite Samia Hassan, the Executive Director of CASA, to deliver the welcoming remarks.
Thank you so much, Madiba. So I am going to pass it to our board chair, Bharat Sani, to do the welcoming remarks, but I do want to briefly introduce him as this is Bharat's first CASA event as the board chair. He is our recently nominated interim board chair. Bharat Sani is the inaugural Director of Equity, Diversity, and Inclusion with the Faculty of Arts and Science at the University of Toronto. Bharat is responsible for developing and implementing strategic initiatives aimed at advancing EDI within the learning and working environments across the Faculty of Arts and Science. He provides strategic directions, guidance, and advice to the Dean's executive team on matters of policy interpretation and practice concerning a range of areas, including accessibility, diversity, equity, inclusion, freedom of speech, and freedom of expression. Bharat has been working in the post-secondary sector for more than a decade. Prior to joining UFT, he served as a manager of human rights, equity, and inclusion with the Center for Human Rights, Equity, and Inclusion at Humber College. He has also held roles with Osgood Professional Development at Osgood Hall Law School, OCAD University, York University. Bharat strongly believes in the importance of community work and engagement. Since 2008, he has had the privilege to serve as the board of the Canadian Association for the Prevention of Discrimination and Harassment in Higher Education. In addition, since 2020, he has been serving on CASA's board and chairs the Human Resources Committee. Bharat completed his Bachelor of Science Honors, Bachelor of Education, and Masters of Education from York University. He is an Ontario certified teacher. He also has extensive comprehensive training and alternate dispute resolution, as well as workplace investigations focused on human rights and workplace harassment. Bharat is committed to transformational systemic change and to advance anti-racism, equity, inclusion, and foster belonging for all. Please welcome Bharat Saini.
Good morning. Thank you so much, Samia, for the warm welcome. I really appreciate it. On behalf of CASA's Board of Directors, welcome everyone. It's so great that you've taken the time to participate in today's Health Equity Summit. I would like to begin by taking a moment to express my gratitude to Samia, Madiba, and the whole CASA team for organizing today's Health Equity Summit. And as Samia mentioned, my name is Bharat Saini, and I have the honor and privilege to serve as the new chair of the Board of Directors for CASA. I'm eagerly looking forward to continuing the great work with all of our wonderful members of this organization and partners. I would be remiss not to acknowledge Sangha Achkaze, our former chair, for her dedication and commitment over several years to CASA. We're still going to be connected with Sangha, and just really want to thank her for all of her work and support and leadership over the years. For our new colleagues and members joining us today, one, thank you for being here. And also wanted to take a few minutes to briefly share some information about the Council of Agencies Serving South Asians. Also, you'll hear us use the abbreviation CASA. So CASA is a not-for-profit social justice umbrella organization representing well over 120 member agencies. And CASA aims to build the capacity of the South Asian communities to be able to fully participate in the political, economic, cultural, as well as the social fabric of Canadian society. Now, as an organization that's focused on advocacy, training, capacity building, and policy change, our focus is not on frontline services. We focus on influencing systemic, strategic, and policy level changes to improve outcomes and well-being of the South Asian communities in Ontario. And, it really broadens across Canada when we look at the work that CASA has been doing and the connections that Samia and the organization has been making across Canada. Our current strategic directions include promoting health equity, reducing poverty, supporting immigration and settlement, strengthening gender equity, and building an anti-racist and anti-oppressive Ontario. We partner with our member agencies and other social justice organizations across the province to work towards our strategic directions. I'm so happy that this is CASA's 11th annual Health Equity Summit. Samia may remember this. I remember my first summit in 2019 when I believe this was at in Peel and downtown. And I'm really glad that we've been able to continue offering the summit in the virtual environment. Again, hopefully next year we can meet in person. The summit has been central to the work that we've been doing on health equity for the last 10 years. And this pandemic has really highlighted significant inequities, and the impact is just far too wide. We must work together and continue taking action for a fair and just society. And this directly is reflected in the objective of these summits, which is to allow South Asian and other racialized communities to discuss how we can work together to influence strategic systemic level changes, which will improve health outcomes for our communities. CASA has covered a wide range of topics, including chronic health, mental health, sexual health, maternal health, migrant health, social determinants of health, policymaking, advocacy, and COVID-19 emergency care and response. This year, CASA hopes to have conversations around community engagement. And I also want to express my deepest gratitude to our colleagues joining us today, who will be sharing critical insights and leading us through several discussions on many topics, which I know Madiba will be going into more detail momentarily. I'll close by saying that this type of transformational systemic change work takes time in a community. So again, I thank all member agencies, our partner social justice organizations for their ongoing commitment and support to advance meaningful change. I look forward to an engaging day with everyone here, and I'll hand it back to Madiba to introduce our speakers and today's session. Thank you.
Thank you, Bharat, and I'm looking forward to working together more in the future. So today, the experts that will be joining us today will include Dr. Farah Mawani, Camille Orridge, Dr. Jennifer Zelmer, Safia Ahmed, Amy Go, Anthony Gladue, Dr. Andrew Pinto, Dorothy Mary Sr., and Fatah Awal. The keynote session will be on advancing community engagement, the panel discussion on community engagement framework, while the breakout speakers will lead discussions on community-informed learning, healing and learning, CBPR and anti-oppressive principles of data collection, and centering community voices in health policy. Throughout the summit, we will emphasize that community engagement is an important step towards understanding the unique circumstances facing populations living with health inequities. And this is especially true when considering these communities' opportunities and barriers to achieving health. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the chat and we will address the questions towards the end of each presentation. We also request that you remain on mute during each presentation. And as mentioned earlier, the summit will be recorded and the recorded version will be available to stream on YouTube. We also have a feedback survey that will be shared towards the end of the summit. Please do not forget to fill it out before leaving today, as it will help us to improve and provide an even better experience for next year. Lastly, do not forget to share your excitements and thoughts on social media. Remember to tag our Twitter, Facebook, and Instagram handle, Casa Online, and use the hashtags 2022 Health Equity Summit, Casa Health Equity Summit, and Health Equity Summit. Now, without further ado, it is a great pleasure to introduce our keynote speaker for today. Dr. Mawani is an assistant professor at University of Victoria and affiliate scientist at Lee Ka-shing Knowledge Institute, St. Michael's Hospital. She is a community engaged scholar who focuses on systemic racism and discrimination as drivers of global, national, and local social and mental health inequity. She specializes in social epidemiology, implementation science, and global, national, and local social and health equity solutions. Her global research is shaped by insight from her lived experience of migrating to Canada from Kenya, combined with years of experience leading community-based participatory research while embedded in applied research, policy, community, and clinical environment. Everyone, please welcome Dr. Farah Mawani.
Thank you so much. I really appreciate the invitation to be here. I wanted to just acknowledge that, partnering with CASA early in my research career shaped my career path and my research approaches, as well as my research program. So it's an honor to be here sharing, some of my learning and perspectives with you. I also just want to say that I'm just coming back from a 6-week emergency health leave. So, please, if I'm unclear in any way when I'm presenting, forgive me, and also, do ask me for further clarification anytime. I also really am striving to speak to the wide range of participants I know are here today. I know that you all have a really wide range of lived and professional experiences, and so, I'm hoping that what I share, is of interest to all of you and helpful. I want to say that, in a summit on sharing and shifting and sharing power, I want to start by sharing power with you. And I really want to ask, participants to tell me what community engagement means to you. Feel free, I'm going to sort of disrupt the plan a little bit and just open it up now. So feel free to either put your response in the chat if you're more comfortable with that, or unmute yourself and share your perspective on what community engagement is. Anyone want to jump in? Oh, I see a hand. Feel free to just jump in. Oh, so Janet, I think I see Janet's hand first. Go ahead.
Good morning, everybody. Greetings from Takaronto, Treaty 13. I am a co-lead for Accessibility for All project for the St. Michael's Academic Family Health Team. So for me, community engagement is to plan effectively, reach out to community where they are, not force them to fit in your mold, your schedule, and also plan for actions, because after the community engages with you, they will ask, this is what we need, this is where we're at, these are the gaps, and the result should be what is the next action to address at least some of those barriers, the exclusion, how to mitigate the urgent issues, and how to plan long-term to stop the barrier and exclusion. And I'm focusing mostly on persons with disabilities.
Okay, thank you so much. There's so much to what you've shared. I really appreciate that. And there's a few others who have things to share. So I'll go to Bob Murphy next.
Yes, thank you. Good morning, everyone. Community engagement to me is being active in our neighborhoods and talking to our community members to find out what their biggest concerns are. And I find through many organizations, whether it be here in Ontario or Scarborough or Etobicoke, that many of the concerns are the same. And by engaging and having conversations with our community members, it tells us what the biggest priorities are, and it's an unfiltered response. And that's how we get a feel for, what the climate is in our neighborhoods and what the biggest concerns are. And it's one-on-one or group conversations that are unscripted and just a simple conversation. And that's how we learn. We have the opportunity to learn from our community members and off each other. Thank you.
Yeah, thanks so much. That's really helpful. And I'm going to go to Emily Kovacs next. And then I do see there's a bunch of responses in the chat, so I'll get to those as well.
Good morning, everyone. Greetings from Niagara. I'm Emily Kovacs. I work at the Niagara Folk Arts Multicultural Center. An honor to be a part of this Health Equity Summit. I think from my perspective, echoing everyone's voices so far from the panelists and also the members who have spoken, I think if we do all of those things, just like our colleague mentioned, the unscripted, honest conversations, and if we do all of the pieces about an ongoing community dialogue, I think the overall goal is to create a sense of belonging, because that's the way we do it. We don't just stop. It's a continuous feedback loop. It doesn't end at year 4 at somebody's, if you're a political leader, it doesn't end at year 4 of your leadership campaign. It doesn't end at, whoever is in a leadership position needs to be able to pick up the pieces and continue the thread and not start all over again. And I think that is the biggest piece, and that's how we create a sense of belonging, because we just continue listening and continue to respond to the needs of the community. And thank you for the work you do.
Thanks so much. Yes, that piece is really important, that it's continuous and ongoing, not just a one-time thing. So I'm gonna I don't see other hands, so I'm gonna just go through some of the chat responses for myself, but also in case not everybody's able to see them. So Candace Gomez from Connecting Women with Scarborough Services says, I understand community engagement to mean building alliances with different members or groups to work towards shared goals for the community. Yes, that is a really helpful definition. I like that idea of building alliances, and the shared goals piece is really key as well. And then Emily, we heard from you directly, so that's great. And then Flannery Sadler, I think from Scarborough Health Network, if I'm getting the right acronym for SHN, active listening and creating and fostering relationships. Yeah, the relationships piece, and I like that you've put fostering, so it's not just creating them. And Sarah Clark says working with community in a way that aligns with their priorities. Yomna Omar from CASA, working with the community that the program, intervention, etc., will relate to and would benefit from, giving them some agency and a voice in what they need. Yes, those two pieces, the agency piece, I think is so key. And we have quite a few responses, so I don't want to take up all the time going through them now. I'm really grateful that we have so many responses. But I think, all the different things that you've shared really, go to my next point, or speak to my next point, which is that there are a range of definitions of community engagement. There's a range of ways that it's implemented, right? And this is a simplistic continuum, but really, I think from my experience, this is kind of a broad overview of the range of ways that community engagement is implemented. So sometimes we have token engagement that is really done to satisfy, the needs of a funder, maybe, or for political reasons, but it's really for visibility rather than true engagement of the type that most of you are really sharing in your definitions. And I think, I do want to say that maybe after this summit, it would be great to sort of have a collection of these different definitions that come from your experience. And then we have, what's often referred to as meaningful engagement, which is aiming to go beyond token, but I think when we talk about meaningful engagement, and that could be operationalized as consultation with communities, it could be, it could be a one-time consultation, it could be having an advisory committee that you meet with, regularly. But I think we really need to ask questions about, those relationships and, who initiated the relationship, who set the priorities. These are some of the things that you've talked about, that it's important for communities to set priorities for themselves. What is the nature of the relationship? Who is leading the relationship? When we talk about the person who's in leadership or the organization who's in leadership, is that leadership by community members? When we have advisory committees or different forms of consultation, are community members, do they have the power to share honestly and openly, unfiltered, as some of you were saying? And when they do, is their input really integrated into decision making? Do they have decision making power at the table? So all those things I think are really important for us to ask about. What power does community have at the tables they're at, in the teams they're in? And so, I want to move to kind of another question for you. And it's really, some of you have got to this in your responses, but why is community engagement important? What kinds of impacts are we hoping to have when we engage community? And again, feel free to respond in the chat or put up your hand, and I won't be able to get to everyone, but it would be great to hear from a few of you. So I see Janet Rodriguez has put nothing about us without us. Yeah, that's a really good way to summarize why it's important. It doesn't make sense for work to be done for communities without communities. It's so important to, and I didn't highlight, this enough when I showed the continuum, but, to go from the different types of what are referred to as, meaningful community engagement to leadership by communities. And, oh, thank you, perfect timing. So Sobia Ahmed has shared that, community engagement is important to achieve sustainable outcomes, equitable decisions, and working on continuous relationships. Yes, really, really important points. And I think that piece around sustainable outcomes, we don't want to have an impact for a really brief amount of time and then have, things fall apart because we haven't, really engaged with community in an effective way. And it's important. So we have Ahmed Ramin Ayaz, to know their needs and ask government and responsible authorities to meet their needs. Yes, to advocate for community needs. We really need to hear from community, to work with communities. And yeah, so many great responses. I really, really appreciate that. And yeah, I agree with Samia. It's great for this to have this engagement at a summit on community engagement. Yes, and this piece, and sorry if I miss yours, I'm just going to go over a couple more and then I'll move forward. It's important because it builds stronger, trusted relationships with the community and enables the organizations to meaningfully respond to community needs. Yes, trust is such a key point to raise. And that was from Shimona Shafinaz. Jane Nakila, it is important to achieve the mission and vision of the programs in the community. Yes, and then Janet Rodriguez, everyone is in community, but not everyone is included in research. Yes, community members should mirror who is included. And yeah, we need to bridge barriers. I agree with all of those things. Those are really, really important points. Okay, so thank you so much. And again, do feel free to add comments as you think of them. But I'm going to move forward. Well, I guess one thing I want to just ask you to think about in particular is, why is community engagement especially important right now in the context we're in now? And I'm going to talk a little bit about some of, my perspectives on that. So yeah, if you can go to the next slide. Thank you. Community engagement of the type that I strive for, which is lived experience leadership, leadership by people who experience systemic racism and discrimination, is especially important at this moment when the communities most affected by COVID-19 and have been excluded from government pandemic response decision making, and that exclusion is because of systemic racism and discrimination, but then it also has led to systemic racism and discrimination in government responses, and that has then further widened social and mental health inequities generally, but I focus primarily on mental health inequities. And, we know now that the COVID-19 pandemic has had a severe impact on the mental health and well-being of people around the world. Some data was released a few months ago by the World Health Organization that showed that the global prevalence of anxiety and depression increased by more than 25% in the first year of the pandemic. We don't yet have updated data to see how much more that may have increased by now. In that data, the greatest increases in anxiety and depression were among youth aged 20 to 24 years, women, people with pre-existing chronic conditions, and people in low and middle income countries. That's like the global perspective. We know that there's been in terms of more locally, there's been an especially high burden of COVID-19 among South Asians. Racialized communities more broadly have been affected with a higher burden of COVID-19. So if you could go to the next slide. Great. Yeah. So there's a study that was just published a few days ago that I've referenced here by Sonia Anand and quite a large team. So I wasn't able to include everybody's names there. But their findings, they did research focused on South Asians in Peel region and found that from April to July 2021, 24% of their sample of South Asians in Peel region had serologic evidence of prior SARS-CoV-2 infection, and 1/3 of that sample were essential workers. And many of from your own experience and your work, how hard hit Peel region has been, and how hard hit South Asians in Peel region have been in particular. We really need to think about what impact does this high risk and burden of infection have on the community's mental health, especially in the context of systemic racism that drives, higher risks of infections, hospitalizations, long COVID, and death. When I mention systemic racism, I just want to say a couple of things about it before I move forward. That I'm talking about systemic racism that puts people in the position of being in precarious frontline essential work. That puts them at higher risk of contracting SARS-CoV-2, and then the systemic racism and discrimination in government response, right? The lack of paid sick leave policy, and then the inadequate policy, the lack of a targeted public health approach to the hardest hit Peel neighborhoods, despite the advice of Ontario's COVID-19 Science Advisory Table. And so if you could go to the next slide, that'd be great. Yeah, so just, the UN Secretary General really highlighted quite recently that without determined action, the mental health impact of the pandemic may last for far longer than the pandemic itself. He made a strong call for action to reduce social and mental health inequities. And I just want to say that in addition to what action we take, how we take that action is critically important. To re-emphasize, we really need leadership by people with lived experience of systemic racism and discrimination to redress historical exclusion, ensure that systemic racism and discrimination are addressed, and to advance research to enable the transformation needed, and also to improve the relevance the uptake, the effectiveness, and impact of solutions. And a lot of you touched on these points, in your definitions of community engagement. So yeah, if you could move to the next one. Okay, so I'm leading the Building Roads Together Global Solutions Network, and it's a multi-site community health system university partnership, adapting, scaling, evaluating, and sustaining the Building Roads Together program. And Building Roads Together is an intergenerational, trauma-informed, peer walking, rolling program implemented in public urban green space to promote social inclusion and mental health. So yeah, if you could go to the next one. So the name of the program and its shared leadership approach, come from a needs assessment that we conducted before developing the program. It's not about showing people the path and then them following you. Sometimes it's walking along the path with them. And again, this is a theme that came up in a lot of your definitions. Sometimes you will follow them, other times they will follow you. It's building roads together. So you could go to the next one. Thanks. I designed Building Roads Together based on that needs assessment that I mentioned in partnership with the Center of Learning and Development, a community-based organization in Regent Park, Toronto, led by Black, Indigenous, and racialized community leaders. The findings of that needs assessment, we combined them with research evidence on the benefits of peer support groups, walking in green space, on mental health. And then also I integrated my lived experience of migration, racism, growing up in a Toronto, low-income Toronto neighborhood, and my experience of trauma and recovery. So if you could go next. I just put this up here in case some of you are not familiar with Regent Park. I won't go through all these details, but really a key point is it's in the midst of a really huge transformation from Canada's first social housing development to a mixed income community. And that's the context in which this kind of program was needed and really, valued by the community. So if you could go to the next slide. So we did an impact evaluation and, based on a positive, very positive evaluation and demand for scaling the program locally, nationally, and globally, I formed the solutions network that I mentioned. If you could go to the next one. I'm not, because of time, I'm not gonna, read out these quotes, but I have a few slides here of just some of the key sort of things that highlighting some of the key things people shared about their experience of the program and what they valued about the program. And even when we asked for critical feedback that we could use to improve the program, we got feedback like it should be 3 days a week instead of 1 day a week, so people really responded to it and just wanted the program to continue and to expand. So I'm going to just go, if you could just go through the next few slides, and then I'm happy for these to be, shared so people can look at them more closely. But, this is just showing you a bit about what our solutions network is working on. We're a multi-site partnership, and we have an equity strategy that sort of shapes everything we do. We have a research program, and that research program is about adapting, the program to specific community contexts. And now we're also adapting it to the COVID context because the pilot and the evaluation were done pre-COVID. And we're scaling it to new communities and evaluating it. And a key point that some of you brought up in your definitions of community engagement, that we're really, our goal is to sustain it in those communities. And then we have a training component. And if you could just go to the next. So this is the main thing I want to highlight, is that, you know, why did we have such a positive response in our evaluations? And I really think so much of that was about our community engagement approach. And these are some of the things that, you know, make up that approach. It wasn't just about partnering with any organization based in the community, but it's really the right organization that has values around community leadership and then implements those values, right? So we worked with, and we continue to work with CL&D, which is, you know, really exemplary community-led organization. And they've been working with us from the beginning of the needs assessment, the program development, and it's been a long-term relationship since then. You know, there's leadership by people with lived experience of systemic racism and discrimination. It's trauma-informed. You know, we have a shared leadership model, as I mentioned earlier. And you know, the partners who are not based at the community organization spend time embedded in the community. So, you know, I did quite a bit of that and continue to do that. I live just on the edge of Regent Park. To develop that relationship. It's not just about kind of parachuting in briefly and leaving. So those are, and then the long-term relationship piece, I think a really key thing I want to highlight there is it's not just about the length of time, but the nature of that relationship and how you work through challenges that arise. You know, it's, of course, in any relationship, challenges arise. And I think building and fostering that relationship through those challenges, using those as opportunities to strengthen the relationship is really, really key. And now, and the reason I have this photo of a heart here is that the network, you know, at a meeting we had decided that we really wanted to keep Regent Park as the heart of the program as we scale to other cities in Canada and globally, and that the community engagement approach and partnership approach we've had in Regent Park is something we want to scale to the other sites, because we know that's a really core part of the program's success. So I have a few more. I'm not going to speak much more, but if you could just quickly go through the next slides. So this, again, this is, I want to acknowledge, you know, the team, the network members, and, you know, at the moment we have a Toronto site team, a Surrey, BC site team, and a Bogota, Colombia site team. And then if you could go to the next, these are just, you know, some of the images of the neighborhoods that we're working to adapt the program to. So Guildford and Surrey, BC. And if you could go to the next one. And this is a low-income community in Bogota, El Dorado, that we're working with. And this is the organization that we're partnering with that shares, you know, the values of the program, that it was founded by somebody who grew up in the neighborhood, it's led by, you know, people who are from the neighborhood. So I think I'll end there. And I, you know, want to thank all my collaborators and partners who contributed to this work, and to thank all of you for the amount of engagement that during this sort of limited time that we've had. And thanks for your patience as well with me going a little bit over.
Thank you, Dr. Mawani, for such an engaging presentation and for highlighting the importance of shifting the power to community-led organizations and community members with lived experience. It really is about co-creating and trust, as one of the attendees mentioned. We do have a bit of time. If you have any questions for Dr. Mawani, please feel free to unmute yourself and then type them in the chat, and Dr. Mawani could probably address them.
Oh, thank you. That would be great.
I have a question.
Oh, sure.
How closely do you work with the healthcare organizations in the area? Unity Health, the St. Michael's Family Team. How much is the involvement, and also what other grassroots community are yet to be tapped?
Yeah, that's a great question. So, I have been, I developed this program prior to this, but from January 2019, I've been based at Unity Health. Though, you know, my relationship with Regent Park community predates that. So that's been an interesting thing to navigate, you know, my place within the partnership. But, you know, I've really worked to mediate that and then to try to improve, you know, some of the approaches that are applied, you know, at Unity Health, you know, based on my experience, and really you know, bringing in community partners, you know, more and more to that process of advancing how we do this work. And then in terms of Untapped, you know, of course, I had a limited time, but from the beginning, there were more organizations involved. So we did work also with the Regent Park Community Health Center. And there were many organizations in the neighborhood and in Toronto who were quite interested in collaborating. And we actually had a walking group of representatives from different organizations who were interested, and we developed relationships with each other. And, you know, we haven't yet received the funding to be able to scale enough to respond to the demand for the program. But I think there's always opening to engage with other organizations. And at this point, you know, we're also learning a lot from the community-based organizations in other cities. You know, the organization in Bogota, for example, they focus on applying arts-based approaches to promote human rights and peace building, and in specifically in working with internal and international migrants there. So it's been wonderful to develop that relationship and learn from them as well.
Yes, thank you once again. We've noticed a big shift, at least I've seen it with many organizations, and especially in the last 2 or 3 years, where we're allowing our community members that have lived experience, housing issues, homelessness, mental health issues, disabilities, that finally, after a long time, our voices were never being heard. And there seems to be a big push that these voices are being heard, that is more in the forefront, because the lived experience you can't learn in a classroom or in a in a university or schooling. And it's great to see that lived experience voices are now being recognized, because the lived experience is our teachers. These are the individuals that we that experience these scenarios, and it's great to see a push. And many organizations are starting to recognize this. It's just basically a comment, and I hope we continue to move forward and allow our voices to be loud and to be out there, so we can all get a better understanding of you know, certain situations, especially when it comes to housing, nutrition, mental health, food insecurity, and so on. Thank you.
Yes, I wholeheartedly agree with you. I do think it's so important to keep pushing for those voices to really be heard, and like I said, to actually contribute to decision making, not to just be heard and dismissed, right? Which is something that I think many of us are accustomed to. So that whole idea, going back to the theme of the summit, sharing power, shifting power, so that people with lived experience are really making decisions that impact them. Well, I'm happy for you to connect with me if you have, follow-up questions. And I appreciate all your comments. I'm going to look at them, when I'm done. But yeah, I've included, my Twitter handle as well as my email addresses if any of you want to connect afterwards.
Okay, great. So if there's no more questions, we'll take this time to take a little break and then continue with the panel discussion at 11:10.
Welcome back, everyone. My name is Sundas Ramzan, and I am a project associate at CASA. I will be taking over Madiba's spot for the next little while for the panel discussion. And I hope you all had a good little break. So we'll get started now with our panel. We have 4 wonderful guests with us today to discuss the work of their organizations and their role in the community. We will start with some introductions, followed by a structured Q&A, and then we will open up the floor to the rest of the attendees to answer any questions that you may have. So our first panelist is Dr. Jennifer Zelmer. Dr. Jennifer Zelmer is the inaugural president and CEO of Healthcare Excellence Canada, the new organization formed in 2020 through the amalgamation of the Canadian Foundation for Healthcare Improvement and Canadian Patient Safety Institute to achieve safer, higher quality, and more coordinated patient-partnered healthcare. Jennifer's longstanding commitment to improving healthcare quality and safety, as well as expertise in spreading and scaling innovations that deliver better outcomes, will help to create this new organization with an expanded capacity to improve healthcare for everyone in Canada. Jennifer previously joined CFHI as its president and CEO in September 2018. She has been a C.D. Howe Research Fellow for several years and is also an adjunct faculty member at the University of Victoria, as well as a member of several health-related advisory committees and boards. Dr. Zelmer received her PhD and MA in economics from McMaster University and her BSc in health information science from the University of Victoria. So welcome, Dr. Zelmer. Thank you for being here. Our next panelist is Camille Orridge. She is a quadrangle member of Massey College and a senior fellow of the Wellesley Institute. She has a career in healthcare that spans over 50 years. In her roles as CEO of the Toronto Community Care Access Centre and the Toronto Central Local Health Integration Network, Camille has worked within all levels of the healthcare system to improve the access, experiences, and outcomes of Toronto's diverse populations. Camille is a passionate advocate for social change and health equity. Among her many achievements, she co-founded Pathways to Education, a successful stay-in-school program for high school students. In 2012, Camille was among the top 25 women of influence in health, and previously in 2011, she was awarded the Health Equity Council Woman of Distinction Award. In 2014, she received the Excellence in Medicine Award from the African Canadian Achievement Awards. Camille Orridge holds a master's degree in health administration from the University of Toronto. Thank you for being here as well. We're excited to hear from you. Our third panelist of the day is Safia Ahmed. In the last 25 years, Safia has held various leadership positions in the public and in the not-for-profit sectors. Since 2008, Safia has been the executive director of Rexdale Community Health Centre. Prior to that, she was a director of primary healthcare at Parkdale Community Health Centre, district officer with Ombudsman Ontario, and manager of finance at Nellie's Shelter for Women and Children. Safia also worked with the United Nations Development Program as a program officer. She is the current chair of the Rexdale Community Hub Board and was the chair of the Nellie's Shelter Board of Directors. Safia earned a Bachelor of Science from Georgetown University and an MBA from George Washington University, both in Washington, D.C. She has a diploma in Human Resource Management from Humber College, and she is currently working on a master's in Public Health at the University of Alberta. Thank you, Safia, for being here. Last but not least, our fourth panelist of the day is Amy Go. Amy is a social worker by training and has dedicated her professional career to serving immigrants and seniors promoting and advocating for culturally and linguistically appropriate care and health equity for racialized communities. For over 3 decades, Amy has advocated for social justice and rights of women and racialized communities through her leadership role in national, provincial, and local service and advocacy organizations. Amy is currently providing consulting services to facilitate organizational strategic development, program planning, development, and review, as well as anti-racism and anti-oppression organizational change. To all our panelists, we are eager to listen and learn from your stories and your expertise. And I will get started with some questions to establish some context of your work. And there's 3 main discussion questions, and we'll go through the panel and learn from each of you. So the first question that I'll pose to our panel is, what is your organizational mission, and how might community engagement help you better achieve it? And so we'll start with Dr. Zelmer and then go on to Camille, Sophia, and Amy. We'll open up.
Thanks so much for the invitation to be here today. And so first question on the mission. So our purpose at Healthcare Excellence Canada is to shape a future where everyone in Canada has safe and high quality healthcare. And we do that in 4 ways. The first is to identify the points of light across the country, the innovations and the innovators that are tackling the wicked problems that we share. The second is then, once we've got proven innovations, to spread and scale those innovations so that more people can benefit. The third is to recognize that we can work innovation by innovation, but we need to build capacity for change within the health system. And then last but not least, local teams can do amazing work, but if they're trying to do that work in a policy or in a structural context that makes that hard, it's a hard road to travel. So we work to catalyze policy change as well. And fundamentally, engagement is central to the work that we do. We try to live nothing about me without me. And in fact, in our initial strategy, one of the core quality and safety perspectives that we try and make sure infuses all of our work is engaging patients and caregivers and communities with purpose to ensure that their priorities drive the work that we do and work across healthcare. And so how do we try and live that out? By having people with lived experience at our board table. We have people with lived experience on staff. We also have a broader network who are engaged in all of the projects that we do and the initiatives that we work on. So maybe that's a laying of the table, and I'll hand it over to others.
Thank you so much, Dr. Zelmer. Camille, could we hear from you next about this?
Everyone on this call have some experience, knowledge about the importance of community engagement. The points that I will make throughout this are not necessarily geared to be negative, but geared towards highlighting the kind of things that mitigate against us achieving what it is we're trying to achieve when we do community engagement. So I'll just start with one. For example, we need to be careful that when we talk about engaging and we have people from diverse community and committees, patients, boards, etc., those voices are usually the voices of the privileged. And so we tend sometimes to get a lot of talking heads. We get people who become professional patient advocates, for example, or professional representatives of communities, and their voice become community voice. But even with lived experience, some of those voices are still highly privileged. So as we go through this conversation, it's just for us to have that in our thoughts so that we don't fall into that trap on an ongoing way. So I'll stop there because I think there'll be other questions.
Sure. Thank you for bringing up that point about privilege. I think it's important to keep that in mind as we go through this panel and this summit in general. All right, so Sophia, would you like to go next?
Thank you to the organizers of this conference for inviting me to be part of this esteemed panel. As an organization that is a service provider that provides primary care and health promotion services, community engagement is critical in the way we work and the way we deliver services to our community. It's important because we believe that it leads to improved outcomes for the communities that we serve. By incorporating community engagement into the decision-making process, we feel that we are better informed and better able to meet the needs of our community. It's, community engagement needs to be meaningful and inclusive because it's important to hear from those that we don't normally hear from. It needs to be planned in a way that removes barriers to access for those who have barriers being able to participate in community engagement, whether it's through different forms of community engagement, whether it's surveys or focus groups or town halls, whatever the case might be, and whether the objective is one that is to inform or to be actually part of a co-design of a program. And in terms of the mission of our organization, our mission is pretty lofty because it is a vision. Our vision is to create a healthy and empowered community. And it's lofty purposefully because that's what we strive to do. And we strive to do so by supporting and advocating for the physical, economic, social, mental, and well-being of our diverse community, by working together with our community and partners so that we can improve equitable access to quality care and services. Thank you.
Thank you. We're excited to have your insight from your organization here. And Amy, would you like to go next?
Sure. Thank you again very much, Casa, for the experience, for the invitation to be part of this esteemed panel. I truly look forward to this. And actually, this is a very tough topic. I have to say community engagement is a very challenging topic, and it allows me to be reflective of the work that we are doing at Chinese Canadian National Council for Social Justice. And let me just preface by saying that CCNCSJ is a very small advocacy organization. We actually established in 2019 with the mission to engage, educate, and advocate for social justice and equity. We are a very small board. We have only 4 members. However, the network that we are part of goes beyond just the 4 people. And as Camille said, most of our network are people with privilege. We are Chinese Canadians with multiple degrees, English speaking largely, and middle class, and have years of experience advocating for social change. And so it is important, as Camille said, when we are advocating for social change, we have to be able to be informed of what's happening, what are the lived experiences of those that are not part of your network, lived experiences that are most marginalized due to race, gender identities, disabilities, class, socioeconomic status, immigration status, non-status, and all that. So I just want to share with you the experience that we have during SARS. And we established in 2019, January, the first case of, not during SARS, during COVID. The first case of COVID landed in Canada. Immediately, we knew something bad is going to happen, particularly Chinese Canadian communities, because of what happened in SARS. Tenants were banned from going home, workers were laid off, just because we were Chinese. And in fact, at the time during SARS, I was working for a long-term care home for Chinese Canadian seniors. We had delivery companies that refused to bring the goods into the center because they believe we all carry SARS because we all look Chinese. And so we knew it was going to be bad. So immediately we reached out to like-minded organizations, such as Chinese and Southeast Asian Legal Clinics, such as Chinese Canadian National Council Toronto chapter. And we engaged the mayor, city councillor Cressy, and others to speak up against the potential rise of anti-Asian, anti-Chinese racism. Lo and behold, that we didn't know that it was so much worse than we had anticipated. However, for us, when we were engaging in that advocacy throughout the pandemic, we have to be informed of what's happening on the ground, of people that were experiencing the hate, the attacks themselves or have witnessed them. So we work with the Legal Clinic and CCNC Toronto. CCNC Toronto already started a portal on to receive reports around individual attacks. And while, you know, the funding that we received from Heritage Canada that we collectively got was able to then further enhance that portal. That portal was very important for us because that helped us sort of like have an idea of what's happening on the ground. We had reports like over 900, for 600 cases the first year, over 900 cases the second year. And these reports help us understand the extent and the breadth and the severity of the attacks that the community groups and individuals are experiencing. And we also knew the importance of not just focusing in Toronto. We knew that there are other groups outside of Toronto that are working towards similar goals. So we engaged them, you know, Project 1907, Vancouver Asian Canadian Film Festival. They were doing similar portals. So we share data, we did collective analysis together. So to us, CCNC, as a small nonprofit, very little resource organization, we have to engage communities and we have to engage groups, particularly such as Legal Clinic, that are on the ground serving low-income community, serving not only Chinese, but also Southeast Asian communities, you know, who are workers, who are single mothers, who are women who experience GBV, gender-based violence and all that. We have to work with partners who have on-the-ground information and knowledge and expertise. And so that's how I define engagement from as a small organization, that we have to know what's happening. Our advocacy position has to be informed by that intersectional, of course, anti-racism, anti-oppression lens, and have to be connected with the lived experiences. So this is, and it's so important for us. And throughout the pandemic, I was privileged to have direct conversations with seniors, with migrant workers, with, I happen to speak Mandarin and Cantonese, and parents and children. And that connections is very important to stay on the ground, so that you are not advocating in the vacuum. You are truly trying to connect and understand the impact of the system on the people who are most impacted negatively by disparities, by inequities.
Thank you so much. I like how you mentioned the idea of not operating in a vacuum, but actually knowing your community. And you say small organization, but you're having a deep and wide impact. So it's very nice to hear. All right, so I'll move to the second question of the panel. And so this is, how do you know the right level of community engagement? And what is a good starting point for stakeholders who want to involve the community? And so here we'll start with Camille first.
Thank you all. Some of these questions are difficult questions to answer in a short period of time. But I would say on this one, community agencies, again, for me, are the gateway into accessing a lot of the folks you really want to hear from. So individuals on committees, on boards are not the only way. So how do you then engage with communities in order to go out and have focus groups, different ways of connecting in order to get the kind of feedback that Amy is talking about? And two things there. Example of an initiative we did at the Lynn in St. Jamestown when we wanted input of that community. The company, as a Lynn, we know we didn't have the credibility. So we hired a company and they went out and hired 20 people within St. Jamestown. And they had some training, and they then had to engage so many people. And then we had a big town hall where they reported back. The techniques that they used were incredible, right? And they say they know that going to people's door and knocking doesn't work. So one woman went to the bus stop every morning and talked to the people at the bus stop, because that's where she met the moms with the children going to work. You know, the Filipino person that was hired, she went to the food store, the Filipino grocery store, and she went there day in, day out, and she got a whole range of people. But each of those 20 had different methodologies that they used to connect with different populations. And that for me is true community engagement. It's the agencies are not the voices of the people, but the agencies have the wherewithal. It's about agencies and stuff being asked to be paid to do this work. Because I don't think community agencies have the staffing, even though they have the knowledge, and it's, you know, it's a lot of mainstream agencies, government want this work now done. They want community engagement, but we have not all collectively said to them, if you want this done, we're only doing it if it's being done right. And here is what it will take to do it right. Because we want to so participate that sometimes we compromise that level of participation. And so that's just a caution for me, again, as we do this work. I think this is exciting work, it's work that is required, but to do it right. And the other last example I'll give is when I was sitting on the Farmer Committee, the National Farmer Committee. And there was no outreach to, imagine no outreach to users, right? So then I said, you know, we've got to do this, and we've got to do the working poor. And so we had some focus groups. But in the drug use community, I had to then connect with somebody who was a drug user, who then created the network, who then created the trust of getting those people. And we had to pay those people because I thought it was their time that was important. And the same thing with the working poor. They had to take time off. We met at a time that was convenient to them. We paid childcare and all of that. But to me, those kind of targeted input of the group that are not usually heard, the LGBT community, the other community, and then I'll stop, that I've recognized now is not being heard through a lot of this are the intersectional communities. So in the Indigenous community, we're just beginning to do work around the kids that are Black and Indigenous. The Asian community have a whole bunch of kids that's Black, and those kids get left out of almost every organized group. So, and there are a number of them. They're not a small group, they're a large group. So it's how do we begin to identify those folks that are lost or not included?
Yes, thank you, Camille. Yeah, I agree. It's like there's a lot of work to be done in the field, but getting to know your community and creating like those specific solutions for them by getting to know them is how we get started. And I like the innovative solutions, such as going to the bus stop or to the grocery store, because you're right, sometimes knocking on doors isn't the most effective way to hear the community. All right, so Sophia, could we hear from you next on this question?
I have so many things that I want to say, but let me start by saying and echoing some of the points that have been made about actually knowing your community. And if you do not know the community well, collaborating with people that know the community and is trusted by the community. So the other point I think I want to make is that organizations are not often resourced appropriately to do this work. This work is a long-term relationship. It has to be sustainable over time, and it has to make sure that you're building this long-term partnership with your community and partners. So oftentimes I find that organizations are not really appropriately funded, and because it takes time, it takes staff to do this work. So, and I think it's also important for organizations to be flexible and adaptable, because once you start engaging the community, you really have to be willing to pivot as things change and evolve, and as you come across unforeseen circumstances. So those are all points of considerations that you want to make. I oftentimes find it easier to just use an example to illustrate how community engagement works in communities like ours. So I'm going to take an example where we, since 2016, we've been seeing a growing Francophone community in North Etobicoke. And these are folks that are not your traditional Francophone population in Ontario. These are folks that are coming from Central Africa, West Africa, other parts of the world, that racialized, that not only needed settlement services, but access to all kinds of services as new Canadians. So we've noticed that this is happening and growing in our community, but we didn't have the relationship with this community. So we thought, okay, these are people that we're responsible to serve, but how do we create this relationship and start engaging with them? So we reached out to a entité Trois, which is a French sovereign planning entity that's responsible for that region of Ontario, and also other French language service providers, Reflecto, Salveo, Auberge, and we said, look, we see this growing community in our catchment area, and we would like to establish a relationship, and can you please help us, and can you please guide us how to better engage with this community? So they were really very helpful and willing to help us. We created a planning committee to engage with the Francophone population, and they guided the process. They connected us to schools, local, we didn't even know there were grassroots organizations within our community that we were not aware of, and people who came together and were supporting that emerging French community, French-speaking community. So to make a long story short, we were able to do few community engagement sessions. We started with surveys, interviews, and then we had a town hall to validate what we heard. And then so we found out what the actual needs were. We were able to determine what the mental health needs, attachment to primary care, attachment to other social services. So we collected all that information and approached the Central West London and said, here is what we're hearing from this community. This is a growing community that need to be served. What are you going to do about it? After some advocacy, we were able to get a Francophone health promotion position funded. And then we went back to the community again, and we said, okay, we have this position now. We want to co-design a program, and again, called people together, and they were able to co-design a program that they felt would, support them. So right now, where are we with that program? We are in the middle of seeking a partial designation as a French language services provider. We have put in place a HR recruitment plan. We were able to recruit bilingual primary care providers, bilingual mental health providers, bilingual front staff, and our staff is now currently being trained in active offer, which is visual as well as bilingual offer of services at the front desk. We've previewed our policies and practices. Our website is a fully bilingual. So all of those things happen as a result of community engagement that we were able to, and that's an example where when you don't know the community. And another example is COVID-19. At one point in time, our community had the highest COVID cases in the city of Toronto. And we only had one testing site in a hospital that was a drive-through, and our community doesn't drive. So we were hearing a lot of complaints about the community. People who didn't drive were taking taxis and having to incur, taxi bills because they wanted to get tested. What we did is, we contacted our community partners, and to make a long story short, we ended up creating a testing site for our community. And we also utilized community ambassadors. And I can tell you, we wouldn't be able to had such a robust COVID-19 response without community ambassadors, because they had such the intelligence that they bring and things that they know about the community and the ways that they have led this process, increasing awareness and sort of busting some of the myths around vaccines and testing is incredible. We weren't aware of some of the, I'll give you an example, WhatsApp. We've been using WhatsApp to bust some of these myths. I wouldn't know that. I have no knowledge of that, groups that share WhatsApp existed in our community, but they do. And that's, again, one of the things that Camille had mentioned earlier on. They bring such a level of intelligence that we wouldn't have been able to, that supported us, and that we wouldn't have been able with that kind of support. We wouldn't have been able to do what we did with that kind of support. So I think for us, I think the challenges, if I can just quickly say some of the challenges again, is that ongoing commitment to community engagement, because even as recent as this year, we went back to our the Francophone community in Rexdale, and we engaged them about COVID-19, because it is a sustained commitment to continue and engage the community that you serve. It's not one-off, because you're building a relationship, and building a relationship means that constant communication. Thank you.
Thank you, Sophia. Those are really impactful stories, I think, and I like that you mentioned towards the beginning of your response, the idea of gathering as much research about the community as possible before you present them to whoever needs to, provide them the resources. Like, look, this is what we know, and now you can use it to help them better. All right, Amy, would you like to go next?
Sure. I'm going to take this a slightly different angle because we're, again, an advocacy organization. Because the question is right level of community engagement and good starting point. Let me say that, and I know that this is going to be so elitist and so bad, but I hope not. CCN-CSJ is grounded on our values and principles, right? We believe that we need to affect social change. We need to combat racism, intersectional oppression, and all that. And so we hope that people who are engaged in CCNC will share that value and share that principle, because that's the mission and our vision, right? Where a society, where everybody thrives regardless of your race, gender, and all that. However, though, and we all know that this value and these principles are not necessarily shared by all, right? Are not necessarily shared by even people who come to volunteer for you. Just give you a recent example. Dear, friend, fellow activist, we've had long history of working together, and then somehow, there is a disagreement between my view and her view about how, historically the stories of Chinese Canadian women should be told. Of course, historically Chinese women did come to Canada regardless of head tax in a very small number. These small numbers of women came to Canada during the head tax time when the government imposed starting with $50 to then $500 in 1923 on Chinese alone. So every time a Chinese came to Canada, you had to pay $500, which is equivalent to 2 years of wages. And because of that, very few people could really afford to have their wives from China to come to Canada. So as a result, women did come, but in a very small number, and usually those are rich merchants, right? Rich Chinese merchants who then apply. And of course, there was girls born in these Chinese families during that time. Again, the number is not that big. So the perspective that I have, of course, is that Chinese women in those days, of course, experienced racism just like the whole community, where we were not able to vote, we were not able to even conduct business, professional schools. There were so many racist, restrictions imposed on Chinese during that time, starting by John A. Macdonald, our prime minister. And so And so, you know, of course, women then experience further barrier because of gender, you know, because of gender expectations, gender discrimination, and of course, social isolation. So you can imagine how difficult and challenging. But then, you know, so we had this, you know, this conversation, but to her is that, oh no, you cannot compare that. You have to compare with China, with the women back in China. Women coming here, their status changed. They were elevated. They were able to work alongside their husbands. They were able to be engaged in that manner while they may not be able to do so in China. And I said, well, you know, if we are comparing that are we saying that all immigrants coming to Canada should be grateful? We are better off, right? We came to Canada for whatever reasons, and that means that we are better off than coming here than staying behind. Of course not. Of course, that's not the perspective. So what I'm saying is that we need to, for CCNC, it is important to have that intersectional lens, understanding multiple, you know, oppressions, and then, of course, then we can advance. We can then analyze policy. We can then talk about the impact of pandemic, just like, you know, Camille, just like, you know, Sophia have said, and so that we can have true equity for all. And so when we are talking about community engagement, that is important for us, right? We need people who come with that intersectional understanding of oppression, not just anti-Asian racism or anti-Chinese racism. And in fact, when I was talking to many community members, as I mentioned before, during the COVID, during the various workshops and, you know, forums and conferences, yes, the Chinese communities, many of them identify with this rising anti-Chinese, anti-Asian hate, very, very, we are severely impacted. But at the same time, you still hear people saying, well, anti-Black racism, anti-Indigenous racism, you know, there is this very ingrained, you know, and of course, we are not immune to that, our system of oppression against Black, against Indigenous. And so when we talk about community engagement for an advocacy organization, a good starting point is, of course, we need people who would understand that, you know, that, and will not condone any form of oppression, would not support any form of racism. And so we need to, so there is, in a way, some screening process involved here. As an advocacy group, our doors will never be open widely to say, well, all are welcome, because we simply don't have that luxury to welcome everybody, because we don't want to dilute and change our values. However, though, hearing those voices and knowing where the people are at is important for us, so that we know that Chinese Canadians still, there is huge, you know, issues of racism, huge issues of internalized racism and stereotypes against, you know, various other groups. And so we need to be mindful of that, so that when we are doing educational work, when we are reaching out to communities, we need to address those. We need to confront that. We need to speak to that. So I take community engagement and involvement from a different angle because of our principles and our values.
Wow, thank you. That was super insightful. I definitely think it's really important to acknowledge that while a group might be fighting for one cause, like for example, anti-Asian hate, obviously there is other problems that exist within groups, and that those need targeting as well. And that exists in all groups of people. So thank you for that insight. Dr. Zellmer, would you like to finish off this discussion question?
It's so hard and so wonderful to go last. I would love to be able to pick up on so many threads from everybody before. So maybe I'll choose a couple. Sophia, I really appreciated your examples of the ways that we need to think differently in terms of engagement, that one size does not fit all, and that we need to be focused on the right mechanisms at the right time. And honestly, we may not always understand what those are, and we may need to figure them out, as you described. One of the interesting journeys we've been on recently is we work with many people who live in long-term care homes. And so how can we use different mechanisms, maybe art-based mechanisms, maybe other types of mechanisms that are appropriate in that context, that may be very different from ones that might be appropriate in a different context. And absolutely, Amy, so many intersections. And I think, Camille, you mentioned intersectionality as well. Absolutely on race, and also on disability, and also on rural-urban dynamics, and also. So it is absolutely not one size fits all. But I think the things that are common are that engagement is built on trust and relationships. And those are long-term efforts, as so many people on the panel have said. And they are also challenging to build and easy to destroy. And so I think one of our biggest challenges, all of us as organizations and as communities, is how do we continue building that bank of trust that centers lived experience and that is responsive to individuals' preferences for how they wish to be engaged, not how we might impose engagement on someone else. So with that, maybe I'll turn it back.
Sure, thank you. That was a very good summary and insight into this question. So I'll go ahead with the last question of the discussion. And Sophia kind of touched on this before, but it has to do with, what do people typically get wrong? And what advice do you have for getting it right in terms of community engagement?
Yeah, I thank you. I think, again, I'm gonna speak from a point of view as a service provider. I think commitment to community engagement, as I said, is a long term. And I think understanding that this is a journey where you're building relationship is very important. It has to be something that's built into your process. It's not a one-off. It can be a one-off. I also think that sometimes we experience engagement fatigue within our communities. And I have to say this because, you know, we have multiple partners that are all doing community engagement with the same community. So, you know, gotta be mindful how we do that. And we have to figure out how, as partners, we work together so that we're not creating undue stress to our community and asking them the same questions over and over again, because that really does have an impact on your own credibility as an organization and a collection of organizations that serve that community, as well as it gets people disengaged because, you know, you're going back to the same people asking the same questions. So you really have to find out a way that we coordinate our own efforts within our community. And, you know, in our example, we meet as partners and we say, who's doing community engagement this year? What are the areas that you want to focus on? And we sort of try to coordinate and have our staff work together so that we can support our community more holistically. The other thing is that we have to be mindful is the expectation setting. Can I say that because sometimes communities like ours, there's so many, the need is huge. And I could just give you a bit of an example. I was looking at the Ontario Health Recovery Dashboard. And if I look at the community that we serve, it scores 5 for material deprivation, which is the highest score, right? So when you're serving a community like that, the need is high. So, engaging the community means that you also have to be very clear what's possible and what you can do, because you don't want to set expectations and then let people down, let your community down. So being clear what you can, what's possible. And in that process, you're not telling people what's possible in the sense that I'm going to tell you what's possible, but also share information so that they are privy to the environment within which that you're working, the resources that you're working with, and within that, they can help you prioritize what needs to get done first. So I would position in that way, because I think if you're gonna work with communities, they're the ones who know what they need and how to prioritize their needs. So they can help you do that, while at the same time, you're not getting yourself in a position that you're over promising and under delivering. I also think that being mindful, and I think Camille already mentioned this, is overlooking voices that are not heard, especially in communities where you have a lot of new Canadians that may struggle with language barriers or other demands on their time. And so making sure that you are actively working in ways to engage those voices that you don't normally hear from, and empowering them in the sense that they are able to participate in the decision-making process, right? So I think that's another piece, and really that takes a lot of time and a lot of trust. I find that I have to tell you a story where I attended one of our community engagement sessions before pandemic, and I started having a conversation with some of the participants, and someone looked at me and they said, "You mean that you're actually this is a way for me to tell you what I need, and then you're actually going to take that into..." I think there is some level of expectation that sometimes people who didn't come from democratic backgrounds, quote unquote, don't really trust the system, don't trust you, that you're actually going to be following through. And again, that's that, slow, steady trust building, and just being really transparent and fidelity to what you're doing. I think all of those are ways that you can, as a service provider, over a long period of time, get to a point where you can have a meaningful conversation, meaningful engagement and partnership with the community that you serve. Thank you.
I agree. Thank you. It's definitely about finding that balance between using your skills and knowledge, but also valuing the community's knowledge and skills and what they have to offer. And that's what builds that partnership and trust. So thank you. Amy, would you like to jump in next?
Sure. To echo everything Sophia said, and Camille, and everybody else. So I just want to say that community engagement to me is actually only an aspect of organizational change, right? System change. And so if the organization or government department or whoever the policymakers or institutions, planning bodies are trying to engage the community, first of all, the organizations really have to look at themselves first, right? To reflect on whether the organizations truly have anti-racism, anti-oppression, equity lens throughout the organization. Who do you have amongst your staff? Who do you have amongst your boards? Who do you have particularly amongst your leadership? Are they reflective of the diversity and the intersectional, diverse communities that we have been talking about? I think that is important. It has to be premised within that bigger framework. Otherwise, to me, it's always going to be a tokenistic, it's always going to be an outside the organizational change process. So that community engagement has to be within that framework. And community development engagement, as Camille said, is about trust, right? So if your organization has never had that kind of representation and inclusion, and all that within the organizations, honestly, it's going to be so hard for you to really understand and trying to do all kinds of outreach to really be embracing the diverse communities outside. So premise on building trust, right? And then to me, the different, that again, putting on my advocacy hat, I would say that I would advocate, that if you are a policymaker, if you are a government representative here, that community engagement is to help us improve the laws. It's to help us break down the barriers in our system, is to break down the changes, the barriers inherent in regulations. So it should be about that power sharing. It should be an ongoing process of change. That to me is community engagement. And as if you are a funder trying to, dish out resources, you really also need to think about what do community engagement mean. Does it mean flavor of the month strategy? Does it so that specific communities get highlighted this month and somebody else gets highlighted, and then, or does it mean that you really want to continually, hear from and engage and support communities in a broad sense? And also, please do not, if you're funding, please do not use community engagement to use that against organization that demand, oh, you guys have to collaborate. You guys have to, and I've heard that too many times in my years of service in the service providing sector, as well as in the advocacy sector. Oh, it has to be pan-Asian, has to be racialized communities. Please do not use that against the organization. That is just not, to me, not true, effective tool for change. And community engagement is resource intensive. In my, short life as a consultant, I've done many, engagement, and coming to hear directly from community groups, as Sophia just said, it is tiring, it is resource intensive, it is very, very, it is a deliberate process that requires a lot and ongoing attention. And so resources have to be dedicated. Again, I'm speaking to funders, speaking to policymakers. And so please don't expect the community CHC to do the work for you without giving them the money to really engage the communities. Please do not expect a settlement agency with very little resources to do this community without giving them the resources. And resources, I mean, every time you even engage somebody, you have to make sure they are compensated. From, don't expect somebody, migrant workers, a non-status, nail salon worker, don't expect them to devote the time without recognizing their barriers and without compensating them. It also means, of course, compensating for the time for outreach. It also means that compensating for the organization to do that, all that hard work. So community engagement is resource intensive. Community engagement is also critical to data collection. As Sophia said, we would recognize on the ground, you recognize the group of African Francophone communities. And how do you do that to ensure that they get their data, their information get reflected in our system? So, and how do you making sure that the data that not just your organization, but also that you're submitting to the policymakers, to the funders, is disaggregated so that the lived experiences of the communities that you are talking about are reflected. So community engagement is critical, because otherwise people are not going to tell you, because they're fearful. If I share that data, I may be deported. If I share the data, I may have repercussions and reprisals. So community engagement is critical to data collection, particularly for communities that face multiple barriers due to all the intersectional barriers that we talk about. So again, this is, just my experience in talking about community engagement. And there is this is the tough piece, right? and I'm speaking also as somebody from CCNs, it is tough. It is very, very hard to have that and to devote the resources, the attention, and that ongoing, deliberate actions and strategies. But it is something that I hope all of us will continue to learn and share, and then, of course, help each other in further advancing this. Thank you.
Thank you. I think it's really important for organizations to really have the structural kind of the nitty-gritty things like data collection, resources, and staff down so that they can have that proper impact in the community. So thank you for mentioning that. Dr. Zalmer, would you like to go next?
So I think, Amy, you ended with the need to share and to learn. So what I thought I might bring to this conversation is a couple of years ago, we actually asked people with lived experience who we were partnering with and those in organizations who were involved in engagement, where did things break down? And also, where were there shining examples and lights? And each of those groups together prioritized 10 areas that they found top of the list. Now, don't worry, I won't try and share all 10 today. I couldn't do justice to that, but to honor their contributions, I will pop them into the chat. So those of you who are interested can follow up, but I will pick up on a few. One was absolutely, and Sophia, I think you started us off on this, something my mother said to me years ago, which was, don't ask a question if you're not prepared to listen to the answer. So, there absolutely needs to be that commitment to action and commitment to clarity of the role of that consultation and what is going to happen with that, as well as the loop back to say what did happen so that people actually see the results of that work. And sometimes it may not always have been possible to move in the direction that you thought at the beginning, but that trust is built by the clarity of the reciprocal conversations as well. So that was one. Certainly, Amy, many people also identified the resources necessary to do this work well. And that was on both sides of the equation. So people with lived experience absolutely need the resources, whether it's financial resources, whether it's information resources, whether in some cases it's resources to support different forms of accessibility, for instance, having a companion, other types of supports that make engagement safer. We also heard from those on the organization side that they need supports to do this work well. Because for many people, it's a new experience. It's maybe not a way of working, a culture that they've been used to being involved in. And so, there's a fear on behalf of many in organizations, particularly mainstream organizations for whom this may not be embedded work as you described, Amy. And so I shared words of wisdom that First Nations coach who we were working with recently shared. And she said, don't not start, and then don't stop. And it will be a learning experience. There will be times where you feel like a toddler and you sit down unexpectedly and have a mess. And you need to figure out what happened and pick yourself up and learn through that experience as well. And maybe the last one that I'll share, because this also came through loud and clear from people with lived experience, is don't expect me to represent everybody who has some dimension like me. One person can't be expected to carry that weight. And so think about mechanisms of engagement that support broad engagement and support people who may be at different tables to be able to tap into communities and tap into experiences in different ways. So with that, I'll pass it back and I'll share the links to all 10 from both groups if you're interested in the chat.
Yes, please. That would be amazing. I think it would benefit our audience to look at those. And Camille, would you like to give your input to this question, please?
Yeah, just two things. I think engagement is the flavor of the month. I think everybody has it as a tick box. And everybody without the experience and knowledge just need to get it done so they can put it in their board report, etc. I think coming out of COVID, there's an opportunity now of all the groups. Amy has talked about it, all the various groups. One is ensure that every agency sits in those principles of that you outlined, Amy, and you could put that out. I think that would be really good in the chat. The other thing is, I think agencies now collectively have some ability to say, given what happened in COVID, given the value we all experience of ambassadors, we need to have ambassadors in our staffing funding. And not necessarily you always hire an ambassador and staff, but you have the funding to hire the ambassadors based on the project you're doing. But the core funds, and I think if everybody begin to really advocate for that, say at Ontario Health, and using COVID as an example, is the way to go. The other thing, I think agencies, it's hard, but maybe it's time we also say no to certain folks who want to do community engagement. So you say to, if you're in an area with hospital, it's okay, all 5 of you want to do community engagement, let us get together, because we're not going to our community 5 times. So, you know, let's organize an approach, fund it, and then let us figure out how we're going to get it done. Because 9 out of 10 times they are asking the same questions, and it's the same question you already have the answer for anyway, because you have done it before. So I think this is the time when agencies can begin to organize yourselves to maintain good community engagement and do some pushback on mainstream, because they just need to tick a box and you have to live with it with your community. And because 10 have come at the same time doesn't mean you have to do 10 engagement, because as you says, Safia, you're exhausted, right? And history have taught us there's been no value in some of this in terms of our community. So again, we need the data collection, we need all of that, but until people can also tell us how they're going to use the information and what the outcome is, and they're going to report back to the community, I would say for some of those, you begin to say no. But those are just some of the planning things that I think agencies need to begin to collectively talk about, so that you can maintain good community engagement and not be driven by the mainstream with the money who just want the boxes ticked.
That's very true. Thank you. I think that's definitely a main point that you all have discussed, that you can't keep going back to the same communities, different organizations, just going back and kind of annoying them with all this community engagement stuff. And we really have to take time to develop proper strategies so that we're working with them in a respectful and good manner. All right, so thank you all for this wonderful discussion. We learned a lot from you, and I'm sure the audience feels the same way. So now we will move on to a question and answer. So we have some questions in the chat, so I'll go through those, and if anyone wants to put other questions, they can as well, or also raise your hand. So I'll go through the first question, which was posed by Candace, and she's asking, what are some barriers to community engagement? And anyone can take the floor and answer.
I think Safia covered some of those earlier, so I'll turn it over to Safia, for the person with the, with the direct experience on this one.
Yeah, I think I did mention a few. Some of the barriers is time, resources, not really knowing your community, the community that you want to engage, inability to make community engagements part of your process and having this as a sustainable long-term part of your overall strategy. I think sometimes what the other thing that happens is timing is also critical. I find that timing is critical, actually, within community engagement, and sometimes finding the right time to do community engagement with that particular community that you define. And it's also important to define who you're going to engage is critical. I think if you don't have trust and haven't built trust with the community, it'll be really difficult to engage in a meaningful manner. Somebody mentioned, I don't remember, I think it may have been Amy, organizations should actually represent staffing, board, volunteers should represent the communities that they serve. And I think it does open to doors to better able to engage the community, because if your staff does not reflect the community that you serve, I think it would be very difficult to build that credibility with the community that you're serving. So I think having that diversity in your staff is very important. I think trying to do things quickly and expecting miracles sometimes is a fault that, you know, we are always pressured by timelines, by deadlines and things like that. So really stepping back and putting the value on meaningful engagement as opposed to the timelines and the pressures that we feel, I think it's important. I think there was another question about in the chat, engaging folks that are, or community members that are oftentimes are not part of the engagement. How do we do that? I'll give you an example. We are part of the Central West Ontario Health Team. And our health team, Ontario Health Team, decided that they're going to recruit patients and caregivers from our community as a patient advisors, patient family advisors for the OHT. There were a few from our community, and the meeting happens in Brampton. It happens in an evening. And there's an expectation that folks that live in North Etobicoke are going to come into that meeting. Just to think about it, how difficult it is for someone who lives in North Etobicoke to participate in that. And, you know, so we raised that as an issue, and we said, look, you know, if we want fulsome engagement and we want all voices to be there, we really need to figure out a better way to do it. And we didn't really have success with doing that. So we have to figure out, how do we support our community so that they can better able to participate in these tables. We had a couple of community members who were really keen on participating. These are generally folks that haven't been keen on participating before, and they really wanted to do it this time. So we had to, you know, get a taxi to take them from North Etobicoke to Brampton Civic Hospital, or Brampton Peel, I think it was Peel Memorial Hospital, where the meeting was taking place. Pay for that, because they don't have transportation to get there. One of the members had a needed translation. We had to get someone come along to interpret for that individual so that she feels comfortable. She did speak some English, but she wanted the comfort to have somebody with her. So I'm just giving you examples of kind of things that oftentimes happen, and we expect you know, community members to participate in a process where we deliberately designed to be exclusive to people who drive, who have the time to come in an evening to a meeting at Peel Memorial Hospital. And that, I'm not saying that as a criticism of my OHT, but I'm sharing that with you as something that oftentimes happens, and we have to figure out a way to support our community members who are keen in participating in this kind of engagement.
You see, Sophia, it is a criticism, and we need to criticize them, and we need to have groups who vocalize that as a criticism, because we've got to get those folks to know that they need to get their butts out of their chair, out of their comfort zone, out of their stuff, and actually go to where the people that they serve reside, and they need to go into communities. And, you know, I think they need to be hearing that from not just you, but from all the agencies who then consistently say to them, no, you know, our people may not be the kind of people that have time to come and sit at all your committees, for example. How about you have 2 or 3 meetings, organize it so you can get the input from a number of people onto the 3 questions you have. right? It's not just the committee is the only vehicle. And a lot of mainstream and those think, get one or two people to come, then we have done engagement. And I think we have to just collectively begin to do some pushback on some of those things, because that's what we learned from COVID, right? Public health did drive through, and it wasn't until the CHCs and Rexdale and Black Creek moved stuff into their communities that all of the vaccine thing got vaccinated, because they were saying they didn't want the vaccine. That had nothing to do with that. It was you didn't structure it in a way that, they could be there. They ignored the people who worked overnight. I think we need to use COVID as a way of pushing back, reminding them what worked, reminding them of the changes that's required, stuff. So, I'm really glad you do that, but that's the way we community have always bent over backward for mainstream. And I just think there are times when we begin to collectively, not you alone, but everybody begin to collectively saying, no, enough is enough. Stop. Come on, guys, stop.
Can I also just make a quick comment about the community ambassadors? I think the role of community ambassadors is very integral to the health and well-being of communities that we all serve. And if nothing else, COVID has proven the important role that community ambassadors play in engagement, in awareness building, in service navigation, in all kinds of different ways that community ambassadors has really made a difference in people's lives during the pandemic. So I think we should all, and I agree, we should all be advocating for having community ambassadors an integral part of the staffing complement for our healthcare system, because it's less expensive. To be honest with you, the value that you get out of community ambassadors is significantly more than what you would get from any other health, health professional, because the what you pay and what you get back is really it's not balanced. It's really ways towards the community and better health outcomes. And I wonder sometimes whether we need to lobby community colleges and to really create and recognize this as a separate discipline, because we live in a community in a world where credentialing is more important sometimes than the skills that people bring. Many of the folks that have been community ambassadors in our communities are people who either know the community very well, bring really value, they're trained, internationally trained health professionals. So I'm thinking, how do we utilize that resource that exists in communities and make this stable in our healthcare system? And perhaps one of the ways is to create at community college level, right, and credential these skills.
Perfect. Thank you so much. So in the interest of time, we can't take more questions. But if the panelists are able to, if there's any questions in the chat, if you have time during the lunch break, you can go ahead and answer them there. I'm sure everyone would appreciate that. And Dr. Zelmer and Amy, do you have any last words that you'd like to say to finish off this panel?
Just very, very quickly. Because I see in the chat line something about data collection and the analysis, and I totally agree. It's a huge challenge, and again, I would put it on the funder and policymakers, as Camille said. They have to fund this. They have to build the capacity. They have to have legislative mandate to ensure that the disaggregated election is across the board. And of course, standardization, not in terms of the specifics, but around the standards, so that we all have a standard set and rules that would help us have a profile about Canada, about lived experiences of Canadians of all races and genders and all that. And I think that is important. And we also need to have funders and policymakers and institutions, like Jennifer's, that would work towards that already are collecting data and using data and devote the attention towards disaggregated data. And for community groups like CHCs and others like settlement agencies, funding has to be there so that they have the infrastructure, capacity, skills, and expertise. Because disaggregated data is not just for policy change. It is for service delivery. It is for high quality service that are really responsive and that are adequate. So I think those, those infrastructure and all that have to be in place. Thank you.
Just a huge thank you from my point of view for this conversation today. And Amy, I agree with you that if we don't have the structural and policy environments in place that make this work easier to do, then it's going to be a hard road, right? So we need everybody at the table to make the right thing to do easier to do.
All right, thank you to all of our speakers for such a stimulating and insightful discussion. So now we'll have our lunch break from now until 12:45. We hope that's enough time. Please feel free to grab your food, and you can come back to network with the other attendees in the chat for a more immersive summit experience. And we'll see you after the break at 12:45 p.m. for some breakout sessions. Thank you again. We hope you're enjoying the summit so far.
Hi everyone, we hope you had a good lunch break and are feeling refreshed. Now we will start with our breakout session. So for the first breakout session, Community Informed Healing and Learning, we have Anthony Galadu. Anthony Galadu is Plains Cree from the Keywan Cree Nation. He's a graduate from the Center for Indigenous Theater and has been performing since the age of 6. Anthony is a traditional dancer, native flute player, powwow singer, and traditional knowledge keeper. He is currently working at the Toronto Council Fire Native Cultural Center as the Anishinaabe Min Coordinator, or I Am a Kind Man Coordinator. I apologize if I butchered any words. Next up, we have for the Community-Based Participatory Research, or CBPR, and Anti-Oppressive Principles of Data Collection, we have Andrew Pinto and Dorothy Mary Sr. Okay. So Dr. Andrew Pinto is the founder and director of the Upstream Lab, a research team focused on tackling social determinants, population health management, and using data to enable proactive care. He holds the CIHR Applied Public Health Chair in Upstream Prevention. He is a public health and preventive medicine specialist and family physician at St. Nicholas Hospital in downtown Toronto and an associate professor at the University of Toronto. He is also the associate director for the clinical research at the University of Toronto Practice-Based Research Network, also known as Utopian, and the lead for artificial intelligence and new initiative at the Department of Family and Community Medicine on how new technologies will change healthcare. We also have a Dorothy Mary Sr. She is an experienced patient partner who contributed to many health research studies in her home province of Newfoundland and Labrador, with an almost 40-year career in the healthcare system and drawing from a personal experience as a patient. Dorothy's voice has been instrumental in guiding a variety of projects ranging from a clinical trial to lower emergency wait times to a project developing healthy food policy. Most recently, Dorothy received the 2021 Newfoundland and Labrador Seniors of Distinction Award. At the Upstream Lab, Dorothy contributes to the SPARK project. At this time, I would please allow me to thank Care Center for Internationally Educated Nurses for sponsoring the Center for Community Voices and Health Policy Breakout Session. To introduce our speaker, Fatah Awal, I would like to invite Bessie Nasiopoulos.
Hi there. Thank you very much. It's a pleasure to be here, and thank you for allowing us. It's very, very lively and important conversations held today. And I'm very happy to be part of the Centering Community Voices in Health Policy Breakout Room and introducing our speaker to share his perspectives as a community public health and health equity advocate. Farah works with community, public, and private sector organizations and nonprofits to engage in systems change work. Farah is a member of Equity Mobilizing Partnership and Community Impact, an advisory group that provides health equity assessments on project decisions to health system stakeholders in order to improve health equity. In the past, Farah worked in the Office of Counselor and Chair of Board of Health on issues such as addressing vaccine hesitancy and public health funding cuts. Currently, Farah is the Diversity Youth Fellowship Coordinator at the Urban Alliance on Race Relations.
Once again, thank you, Bessie and the Care Center for Internationally Educated Nurses. We will now be opening up the breakout rooms. Please drop a message in the chat or raise your hand if you have not been assigned to a room or if you're experiencing difficulty accessing the breakout room. So we will now hear from our note takers who will summarize their breakout group discussions. First, we can have Warda to talk about the community-informed healing and learning session. Warda, please take the floor.
Hi, everyone. Thank you so much for your great sessions. I just stepped back and listened, and I learned quite a bit. So I took notes for the session with Anthony Gladu. We started with first, speaking about Anthony's role and the intergenerational trauma experienced by Indigenous men, how he combats that with his work, how he looks at urbanized Indigenous men and women, I believe, acclimating to the city life, being separated from Indigenous communities. He then went on to speak about the 7 grandfather teachings. He broke down each teaching in depth. It was a great talking points. He really went into what it means to connect with communities through the lens of these grandfather teachings, whether it be through love, through respect, through humility, through bravery, through truth, through honesty, and through wisdom. I think I can best summarize it by showing how you can control your environment to bring your community together. You can learn from your community. You have to step back and take a position of humility to learn from others, which is something that service providers should really adopt in order to understand that there's no higher grounding when talking about community healing. We can all learn from each other, and there's no one right way. We then went into the session questions that were outlined. We talked about the collaboration between Western medical knowledge and traditional healing practices. We didn't really have a set answer here, but we summarized that, each person has their own choices on what medical attention they receive. It's not in our position to judge anyone's decision. Many Indigenous people do seek and utilize the healthcare system. Some refer to their own medicine chest in their Indigenous communities, and there's no one right answer here. Using the hospital and using the healthcare system and leaning on it is not necessarily bad. There can be 2 paths here. Janet, I believe, then went on to talk about how we do need to preserve ancestral knowledge, though. There's many natural healing processes and practices that are equally as valid as Western medicine, and they should not be undermined just because they have to do with natural healing. So to summarize, we talked about how well-being is not fixed in one category, how also your social location can affect your health. We dived a little bit into social determinants of health. We talked about how the pandemic exacerbated health conditions in racialized communities. We then went on to our second question to talk about the collaboration between Western medical knowledge and traditional healing practices. And here we broke it down to talking about how slowing down is beneficial, how instant gratification has negatively impacted many. And we didn't really find one single answer to address historic power differentials. the conversation branched off into talking about finding balance between work, life, and play, connecting to traditional alternatives such as the medicine wheel, the grandfather teachings, and again, what you find culturally important. We concluded the session by talking about how bravery comes from being vulnerable and being yourself. And that's really how to connect with community healing, is positioning yourself forward and then learning from that and then educating the community. Thank you.
Thank you, Warda. You kept repeating that there's no one right answer when it comes to healing practices, and that both the traditional and Western healing practices are equally important and valid. And that is absolutely right. So next we have Sandas, who will talk about the CBPR and anti-oppressive principles of data collection session. Sandas?
Yeah, thank you, Madiba. Hi, everyone. So yes, I was in the second breakout room, and we had a very good discussion with Dr. Pinto and Dorothy as well. So we basically talked about how in Canada, there's a lot of money going into the healthcare system, but there's not a lot of impact that's occurring in terms of reducing inequalities that exist within the healthcare system and in the services that we're providing to the public. So we're looking at mainly social determinants of health. So those have more of an impact on people's health than does access to healthcare and healthcare services. So those play a smaller role, but about 50% is actually social determinants. So things like income and race, gender identity, immigration status. And so Dr. Pinto was saying that these are aspects of healthcare that are not really focused upon or researched a lot. And there's not a lot of history in Canada of looking at these factors. And so he has a research group called the Upstream Lab, and they tackle these upstream factors that impact health. So basically looking at social determinants, coming up with questions we can ask people to gain a better understanding of how these impact healthcare, and then using those answers to modify and improve our healthcare system so that we can deliver better care. And so he mentioned that some of the problems with data collection are that it's not collected routinely, it's missing a lot of information, and it's not organized in a systematic way. So he wants to tackle this problem so that we can impact the healthcare system. And there's many different ways he talked about that. So for example, data collection can change the care that doctors provide. So for example, they can prescribe lower cost medications if they know about the like things like income of patients. They can refer to community organizations and different services in the community. And it also extends to the whole practice, so the way that all the physicians are operating in the practice, or the whole clinic as well. It also impacts advocacy. And then at the larger level, it can impact policy change. So if we know data about things like immigration status or race, gender identity, then we can create better policies to tackle these factors in terms of healthcare. And then he was talking about a project he has, or a tool that he developed called SPARK. And so that stands for Screening for Poverty and Related Social Determinants and Intervening to Improve Knowledge of and Links to Resources. And so these are questions that he developed with clinicians and patients with regards to race, ethnicity, income, gender identity, sexual orientation, and other social determinants. And it was developed back in 2013. And the goal was to basically develop a standardized approach to ask questions. And then those questions were refined with patient input. And they interviewed a lot of Canadians to get their input on the questions. And so this tool, so Dorothy was one of the patients who was involved in developing these questions. And so she provided her input on, basically she said that patient partners were part of the team equally. And so they had a huge role in developing these questions as well. And so she said that made a big difference. And she was very passionate about her role in this project. And she was from Newfoundland, and she was saying that they have one of the poorest outcomes of health there. And so this tool is helping clinicians to understand where help is needed most and where to put resources. So that was the main discussion with Dr. Pinto and Dorothy. And then in our own discussion questions, we just talked about how best to involve community members in research. So things like, developing long relationships with them, how it's important to have sustained relationships and to go out and make active efforts, not passive efforts, to to have community engagement. And then we also just talked about using resources and people in the community to help address community health concerns, and how all of these different ways can just help us better involve the community and tackle the concerns that they have in terms of their health.
Great, Sandha. So it seems like from the conversation had, the social determinants of health plays an important part in health. And we hope that any service providers in this session will continue to consider the social determinants of health and actively involve the community in their practices. Lastly, we have Myra to tell us about the Centering Community in Voices in Health Policy session.
Yeah, hi everyone. So our discussion, or I guess our session today, was focused on the current challenges of how health policymakers can respond for more inclusive and transformative community engagement processes. And so that's kind of what, that is what Fatah presented on. And so to start off the presentation, we learned a little bit about him and his work experience and how he's an impact member, which I'll touch on in a little bit. And just to define community engagement, as that was the center portion of our session, it's working collaboratively with members of a community to bring about solutions to problems that affect the said community. And communities can be diverse, so it can be ethnocultural, geographical, regional, whatever it may be. And I guess the important aspect of community engagement is that it's an approach to improve health systems and public health. And the reason that community engagement is important is because it helps to address health inequities, empower and build capacities of communities, improve community uptake of services, and then build a representative and equitable health system. And after we kind of went over that, we touched on a little bit about there is a recent report that was released going over the public engagement in Canadian health policy, and just some barriers to meaningful engagement, as I'm sure some of you maybe have experienced yourself or have seen or observed, that there may be a lack of trust between the community and people who are perhaps collecting data or creating these policies. And then there's issues with accessibility, issues with equity, and then even misalignment between the community and institutional priorities. And then from that, we led onto the enabling factors for effective community engagement. And so there are a number of factors, but just a few that we learned about were understanding the community context, allowing for increased community ownership, so ownership of their data, ownership of everything that they produce and that they own, and then involving all members of community. And this is something that we touched on again in our discussion, but sometimes it's not possible to involve every single person, but it's important to have a good representation of your community. And we again touched back on that in our discussion. And then the part that we ended off on was the case study for the Equity Mobilizing Partnerships in Community, or EMPACT, of which Fatah is a member of. And an overview of this initiative is that it's an innovative and novel model of patient and community engagement. And it's basically an expert advisory group that provides health equity assessments to health system stakeholders. So for example, hospital executives. And the members of EMPACT come from diverse backgrounds, academic, ethnicity, etc., and offer unique perspectives to these health equity assessments that I mentioned. And then our discussion, so our first question was, how do we define the parameters of joint health department and community efforts? And like a lot of my colleagues have mentioned, we didn't have one single answer. And some points that I got from this discussion was there's a gap in what the community is experiencing and what they need, and then what is provided to them accessibility wise. So, if they're struggling with other needs, for example, food, education, and employment, they may not have time to seek out the services that they need. And then, it's also important to diversify your engagement, and so that you can build, build services that are that actually serve the community and address the problems that they have. And then, so this discussion went on for quite some time. And then we also have the second question, which we didn't have much time for, was what power or political structures could impact the community's willingness to engage with policymakers? And so for this one, Fatah just, shared his, I guess, perspective that it's we often have a top-down approach where policymakers just kind of propose policies, and then it trickles down, and then it's usually kind of later in the stage where community members are involved. But it's actually best to have a bottom-up and top-down approach, so that the power in creating these policies and maybe services that actually serve the communities is shared, and so that you reach your ideal outcome. And if there's anything that I missed from my session, please feel free to share in the chat.
Thank you, Myra. And again, the whole point of this event was to emphasize community engagement, and that how we should really make efforts to address the, like you said, the misalignment, the accessibility issues, communication, mistrust that we have with the healthcare system. And I think today, the breakout sessions, it seems like there was a lot of great points and like beneficial cross-learning and engagement in the breakout rooms. And so with that, this concludes the report back session. We're going to move on to the closing remarks. Does anyone have any last minute comments or questions that you would like to throw into the main room?
Anyone?
Yes, Janet?
Yes, since we are all here working for health equity, I want to make you aware that the accessibility healthcare standard has already issued the 20 recommendations that need to be implemented. It's specifically for hospitals, but as we know, healthcare doesn't only happen in the hospitals, but it has very interesting recommendations regarding electronic records, how can those be accessible, communications with persons with disabilities, how can that be enabled to seek consent. And also there's 4 specific recommendations about education training to include the concepts of ableism, and inclusion within the medical faculty and all the other healthcare provider education. So I'm going to put both links in the chat. One is the regular text, and the other is a PDF that is for easy read. And it is a great example of simple language of something as complicated as a piece of legislation. So if you don't know about this, please learn. If you want to know more, I'll be happy to sit with you and talk more about it.
Thank you, Janet. That would be great. If everyone could read the recommendations, that would be awesome. Assuming nobody has any further comments, I think we can wrap up our 11th annual Health Equity Summit. On behalf of CASA, we want to thank you all for joining this important event where we cross-learn and enhance our understanding of health equity for racialized communities. My sincere thanks goes out to our terrific speakers for their great presentations, and our wonderful attendees for their active engagement. Also, remember to please fill out the feedback form found in the chat. Please do so before leaving today. And it has been a pleasure hosting you, and we hope to see you next year. Thank you.